biggest things that I've been grappling with, and I think I've seen it firsthand within my family. So my dad right now, unfortunately, he is hospitalized on a ventilator because he got COVID 2 weeks ago, and he's fighting for his life right now. My mother got it shortly after he got it because he brought it home. My little sister got it, and so it's just impacted our family in a really, really, really bad way. And I know that there's so many more families just like mine, especially in the Latino communities and underrepresented communities, who also have families that are going through the same struggles as us. And it's just disheartening to know that there essentially is this systemic racism happening right now, that is basically the administration, especially the state governors, like the governor of Iowa, governor of Nebraska, and the Tyson plants and other food processing plants, are really just letting these workers know with their actions that they don't care about them, and that they're disposable, and that my mother cries every night wondering if she's gonna see my dad again. And this has really caused so much trauma to the Latino community especially, but just immigrant communities across the country who work in these meatpacking plants. They're the largest employer base in this industry, and they're also ones who have more likelihood of having pre-existing conditions too, which also just puts them at higher risk of complications when they contract COVID. And it's just all these things. There's all these health inequities that exist, that have existed before this pandemic, and this pandemic has just brought it up to the surface. It's ugly, and it's a really sad reality to know that this administration has not caught up to speed in just giving reparations to communities who have been systemically oppressed, especially in this industry. And I just hope that Congress members here and other representatives can help advocate for our families, because we're struggling. We're already at a social disadvantage compared to other populations, and it's just really hard.
Can I say something? Is it possible? Sir. I know look, first of all, the stories are heart-wrenching, and there's nothing like worrying about a family member, whether they're going to make it or not, knowing they're in a tough condition. It's not a whole lot. I know this is going to sound like an exaggeration. It's not a whole lot worse than getting up in the morning and knowing your son or daughter's in a war zone in Afghanistan or Iraq or wherever it may have been. It's they're basically in war zones. And one of the statistics we can't lose here is that 52% of the frontline meatpacking workers are Latino. 1/4, 25% are African Americans. And 45% of those folks live below the poverty level for a family of four. And in addition to that, there's a lot of things we can do. I'm not going to take a lot of time, because you have the best members of Congress, the most active and the most successful folks you can have on your side who are going to speak. But number one, we can be in a position where we can provide free costs for COVID treatment, regardless of insurance or regardless of immigration status, period. We can provide paid sick leave for all workers, so workers don't have to leave work to be fired in order, when they get sick, to be able to continue to live. There's a whole range of things. I proposed, and the Congress is thinking about it, that there be a $13 per hour minimum additional pay for frontline workers, including meat packers. Those folks working on whatever salary it is now, and average is about $14 an hour. That goes up to another 13, so it would go to $27 an hour, and it goes across for doctors, nurses, across the board. And we can afford to do that. Matter of fact, we can't afford not to do that. We have to do that. In addition to that, there's a whole range of other things. You can go to joebiden.com, but my point is that this is not only in the interest, and the immigration status, by the way, that folks who are undocumented should be able to join unions in these plants. There should be no deportation for reporting an illness, or they're in fact in trouble in terms of there's so much we can change. But the point I make is we always make this case to ourselves, to those that we all agree, to those who support the immigrant community and the immigrant community. But this is the case that I've been trying to make, and some of my colleagues in the House trying to make, to people who have no idea of what this is about, who buy some of Trump's malarkey about, immigrants are the problem. They need the immigrant population. We need the population. We are strong because of that population, and they should be treated with dignity and fairness. But a lot more to say. I'm sorry to say, but my heart goes out to each of you, and your parents had to be so proud of you. I mean, you've all done so well academically. You've done so well as children. A parent could not be anything other than incredibly proud. And I have a little idea what it's like waiting and worrying about your mother or father dying. I have a little idea having gone through that in a different circumstance. So my heart goes out to you. You're in my prayers, but we can change this. And when this is over, when we beat this virus, and God willing, your parents are okay, we've got to change the system. It's a chance to change the institutional racism that exists and make real progress. And everybody benefits, not just the immigrant community. Everybody will benefit when we do that. We can't let it up. At any rate, I'm sorry to go on so long, but I feel very strongly about this. It's within our power to do this, so we can't fail to do it now.